Disparities in health and healthcare in the United States have been a long-standing challenge, resulting in some groups receiving less and lower quality healthcare than others and experiencing poorer health outcomes. However, understanding the difference between equity and equality is a key component in the effort to reduce health disparities among vulnerable populations. Understanding this difference between health equality and health equity is important to public health to ensure that resources are directed appropriately, as well as supporting the ongoing process of meeting people where they are. In order to reduce the health disparities gap, the underlying issues and individual needs of underserved and vulnerable populations must be effectively addressed.
I spent 6 years on active duty in the Army at 2 different installations, one at Fort Bragg, North Carolina, and then at Fort Meade in Maryland. So for me, I had a back injury from a parachute jump that was initially handled through urgent care. They sent me to physical therapy and things like that. Was not getting better. Problem one was that it took, I would say, 3 to 6 months for someone to decide that it probably ought to have imaging done. You know, they just assumed that it was a muscle strain or something, but it seemed more serious than that to me. Once the imaging was finally done, I had an MRI. They determined that I did have a herniated disc that required neurosurgeon intervention. So getting a neurosurgeon, there was no neurosurgeon, even though Fort Bragg was a large installation with 50,000 or more soldiers, there was not a neurosurgeon on staff at Fort Bragg. So what the arrangement the Army had at the time was that a couple of times a month, a neurosurgeon would come down from Walter Reed Army Medical Center in Washington, D.C., which is hundreds of miles away. So I had to wait to see a neurosurgeon until one of those scheduled appointments became available. I don't know, seemed like weeks or maybe it was even months before I got to see that neurosurgeon. Surgery was not available to me at Fort Bragg, so I had to travel. They put you on orders and you had to travel, spend a couple of days traveling up to Walter Reed, and of course now you're again hundreds of miles from your home, but you have to recover for a few days before they'll let you leave the local area, because if there's complication they don't want to have to travel hundreds of miles to get back. So in terms of recovery, I don't remember a lot of post-surgical care. I think I was given a prescription for pain medication, and I think I might have had 1 or 2 physical therapy visits, just to teach me about how to do home exercises. And that was all often the case, that the expectation as a soldier is you kind of suck it up, soldier on, and drive on.
Was working for Xerox at the time when Paul and I got married, and then he went to law school, and then eventually had to serve his ROTC duty in the military installation. So I ended up leaving Rochester, where I was working, and moving to Fayetteville, North Carolina, where Paul was stationed at Fort Bragg. But I was coming from a pretty major city, Rochester, New York, which had very sophisticated medical care, a lot of high-tech hospitals linked with universities. So I just had expectations of very good medical care wherever I went in the country. But that was not the case when we moved to Fort Bragg. And I was not from a military background, so I had no expectations, didn't know what to, I just assumed it would be the same level of care down in North Carolina. But when I got pregnant with my first child, there was no real prenatal care. For example, I was expecting that I would have an ultrasound to make sure that everything looked okay, and in various stages of my pregnancy, like my friends had back in Rochester. The military doctors pushed back and said, well, there's no risks here that you have. There's no reason to do it. It's too expensive. We don't typically do it unless there's a medical reason. We didn't know, the state of my baby in the womb, didn't know the sex, didn't know if there was something we should be concerned about. So it was a lot of unknowns, and when it could have been prevented by having ultrasound, which was the standard level of care back where I was coming from. When I ended up going into labor, I had complications because the cord was wrapped around my daughter's neck and around her body. So every time I'd have a contraction, it would drop her heart rate to a really low level, which was concerning for the doctor. And so I ended up having an emergency C-section. So I was expecting, because I had such major surgery, that I'd have a private room, all to myself, and a private bathroom. But I ended up sharing a room with another patient, sharing a bathroom, and the doctors didn't come in very regularly to check on you. I just had a different perception of what it was going to be like. It was the bare minimum, basically, and you were just a number. I mean, they were delivering at Womack Army Hospital at Fort Bragg. They were delivering 300 babies a month.
My name's Adriana. I'm a bisexual female. I came out my sexuality about 2 years ago with my friend Brandon, who is formerly known as Brianna. One day, about 2 weeks ago, we were at one of his doctor's appointments to finish his transition. He was gonna have his breast removed, and that's the last thing he has to do. So he wants to be formally known as Brandon, he, him, all that as the pronoun. But the receptionist kept calling him as a her and Brianna because of his insurance and his license that was currently his old one that still had Brianna and his old picture on it. So the doctors and the receptionists weren't calling him a him, which is what he is now. But he felt very discriminated against and got very upset, and we had to leave the office, and after arguing with them about what he should be called and his pronoun and the proper way to speak to him and to treat him for his insurance, which would not cover his breast reduction at all, even though it would for, let's say, like I had a back pain being a female, my boobs were too big and I wanted them smaller, it would be covered by insurance, but because he is trying to be a boy, which he is, they won't cover it. So he figured like he got some injustice there.
Social justice issues and health disparities are critical areas of national and global concern. Their vastness is beyond the reach of any single discipline or profession, including occupational therapy. Engaging communities, professionals, researchers, educators, leaders, and policymakers from all disciplines is required to achieve the collective goals for a just society. Recently, there is an increased need for focus and concern for addressing issues of injustice, as well as narrowing the gap in health status caused by health disparities. As occupational therapists, we work to promote health and to foster full participation in a just society. Just a few examples would include applying principles of universal design to maximize occupational performance for all, helping our aging population to successfully age in place, building healthy communities, promoting the development, occupational and environmental needs of children, and developing skills to aid with disaster preparedness and relief both at home and abroad.